Okay, now let's talk about the different types of fibroids, because from the video, there were different terminologies like myomas and this and that, and we're like, okay, so what are those? Just simplify them for us.
So again, fibroids is the layman's term for the growth.
Okay.
The scientific term for a fibroid is actually a leiomyoma. Okay. Myoma is just short for leiomyoma. Okay. So all those terms mean exactly the same thing. So leiomyoma, myoma, fibroid equals.
Okay.
So they're one and the same thing.
Okay.
So don't stress.
Don't
about that. Yeah. So
okay.
they're interchangeable and mean exactly the same thing. Now you were talking about classification. We classify fibroids based on their location. Again, just understanding that, as I said, the uterus is a muscular structure. So if you have, say, this is the inner lining and that's the outer lining of the fibroid. The inner lining, we call it the mucosa. So any fibroid that's indenting on the inner lining, would call that a submucosal fibroid. Anyone that's inside the tissue, it's neither going to the mucosa or to the outside cover, that's an intramural. Mural means wall, so that is a fibroid inside the wall, of the uterus. And then we have the ones on the outer covering, we call the outer covering serosa, so such a fibroid would be just a subserosal fibroid.
All right. And are there specific reasons why maybe they grow maybe in the inner lining or the outer lining?
No, it's just the location it started growing. So and as I said, we don't know the cause. So why say growing in that particular place? I guess we also don't know.
Okay. All right. Now, in terms of fibroids, how do all of them get detected and diagnosed at the same time, or it's different? In terms of the detection and the diagnosis.
Again, the beauty, and I think she said that a lot of people actually have fibroids and probably don't even know they have fibroids, in that a lot of people don't have symptoms. So what am I talking about? It means that we only deal with people who have symptoms because of their fibroids. Fibroids are benign. Benign means that they don't turn cancerous. Okay? So they can turn cancerous, but in very rare occasions. It's in about if I have 2,000 women who have fibroids, maybe one may get cancerous change from the fibroid. Unfortunately for that person, it's 100%, and it's very traumatizing for everybody. And even I really put that into perspective. I think maybe because I'm not an oncologist, personally, I've only ever seen one patient who had a sarcoma, that is the cancer arising because of a fibroid. However, I'm sure there are many more patients out there. But so generally, if we diagnose fibroids in you, it's something that you should relax, that in as much as it is a growth, but it's generally not a cancerous growth. You understand? So therefore, we really don't need to interfere with you much unless it's causing you problems. For us, probably because our fibroids grow very big, our most common symptom would be menstrual abnormalities. So you find a lot of people get very, very heavy periods. So what would happen is that you'd notice that your period is gradually increasing in terms of the duration, that maybe you used to have periods for 3 days, all of a sudden they are 4 days, 5 days, a week, 9 days. Yeah, like that. But it will be a cyclical period. Then maybe you use 3-4 pads in a day. All of a sudden you need to use 10, a whole packet in one day to contain the bleeding. So personally, from my experience, my most common symptom that brings women to the clinic would actually be increased flow during their menstrual period. Other symptoms, I think the video aptly put it, whereby you can be constipated or even obstipated. That means you can't even pass. You can't even pass stool. You may have increased frequency of urine if it's pressing on the bladder, or again the opposite, whereby you're not able to urinate, depending on the location of the fibroid, and other discomfort. Pain usually will be because of two things. It's either the fibroid is pressing on some structure that has very good nerve supply, or actually on a nerve, or because the fibroid is degenerating. I've tried to find a word that means degeneration in layman's, but it's basically it's breaking down, it's undergoing some changes, and that's the reason you're having pain. So that's that's the second most common reason people will come to the clinic, because they're having pain. The pain can be during the periods, or it can be throughout the cycle. So when somebody's having symptoms, that's when we deal with it. So I've talked about increased flow.
Yes.
So if they have increased flow, they can get anemia. We have people even need to get transfused because of the level of blood loss. The anemia is that severe. They're getting dizziness, headaches, fainting spells. It can be very dramatic, and all because of a period. And this period is made worse because of the fibroid. So for me, that's the most common reason people come to get assistance because of fibroid.